The feds are now allowing pharmacists to bypass your doctor and directly prescribe Paxlovid to treat COVID. So the move was made to increase public access to the antiviral drug.
Paxlovid can be very helpful, but getting the drug, not so easy. Let's bring in our investigative reporter, Candice Nguyen. Candice, what's the problem here?
Yeah, everyone watching, you might need one of these if you want to get Paxlovid straight from your pharmacist, a folder or a binder full of papers, because before getting the medication, which you need to take within the first 5 days of symptoms showing, you're going to have to show all of this. You're going to have to show proof of your positive COVID test, an electronic or paper copy of your medical records from the past year, including blood work from the past 12 months, and a list of all the medication you're taking. It takes a minimum of 20 to 30 minutes for a pharmacist to fully evaluate a patient before they can prescribe the new COVID antiviral drug Paxlovid. And that's best case scenario, says Sanjay Patel, who runs Holler's Pharmacy in Fremont.
With all the questions we need to ask, review the documentations, make sure the labs are in order.
In July, the Food and Drug Administration revised its emergency use authorization for Paxlovid, allowing not just your doctor, but now your pharmacist to prescribe the medication with limitations.
Having patients' labs, having patients' medical history, physician notes, and everything else. Some of the patients who may not have access to those online services from their providers.
So with all that in mind, it's not going to be just as easy as walking into a pharmacy and requesting a prescription.
Richard Dang is the president of the California Pharmacists Association. He says while the goal of this new authorization is to increase patient access, those who are the most vulnerable likely still won't be able to get Paxlovid from their pharmacist and may still have to go to a medical doctor first.
Such as those that are minority populations who maybe are undocumented, who don't have regular access to health care, unfortunately may not have those updated records.
And it's not just patients facing challenges. Many pharmacies may not be able to prescribe Paxlovid because of staffing issues and how much extra time it takes to evaluate patients. In March, the Investigative Unit first told you about a state survey finding 91% of chain pharmacists and 37% of independent pharmacists reported not having enough staffing to ensure adequate patient care.
One time, our pharmacist accidentally gave the wrong narcotic.
And this was before pharmacists were allowed to add on this extra duty of prescribing Paxlovid.
Not all pharmacists and pharmacies will be offering this service.
The investigative unit reached out to CVS, Walgreens, and Rite Aid. They all said they currently do not have any of their California pharmacists prescribing Paxlovid, although they dispense the drug if you have a prescription from your doctor. In a statement, the National Association of Chain Drug Stores called the FDA's action an extremely important revision, but wants the federal government to take the necessary next steps to support pharmacy-based assessments, meaning pharmacy reimbursement for those patient evaluations. In Fremont, Patel says his pharmacist will prescribe the medication, although he says he wishes they had this authorization from the start, so more systems would be in place to streamline accessibility.
It's a great community service.
All right, Candice, this is obviously a big change, a big deal, but I'm wondering why were pharmacists initially left out of being able to prescribe these prescriptions?
Yeah, regulators needed to make sure people taking this medication were getting fully evaluated. You know, this drug, like other drugs, are not without risk, and that's why they wanted to make sure to require, at least at first, a doctor's prescriptions. But now the FDA is realizing that this drug wasn't as accessible as it should be, so now they're incorporating pharmacists into the mix to help with those prescriptions.
All right, so you talk about risks. What are the risks of taking Paxlovid without getting a thorough evaluation?
And there are a number of them, and they can be severe. The reason why they ask for someone's blood work is because they need to make sure that your liver and your kidneys are healthy enough to process this medication. And then they want to see all of the medication you're taking, because there's a chance of a negative drug interaction. For instance, Paxlovid interacting with another drug you may be taking and affecting the strength of it, and then leading to possible overdose.
Got it. Okay. No one wants that.
Nope.
All right, Candice, thanks so much. Appreciate it.